today. I am Samantha Generals from the USNPC, and I am going to perform tube feeding. This procedure allows us nurses to assess and maintain the client's nutritional status, and of course to administer the medications. Then of course, for the assessment, assess for the clinical signs of malnutrition, food allergy, and presence of bowel sounds, and of course the tolerance of the previous feeding on the nasogastric tube feeding. Now determine the type of and the amount of feedings and tolerance from previous feedings, and identify the materials needed to save time and effort. First, of course, we need to introduce ourselves to the patient to prevent anxiety, and we must explain the procedure to the patient, why NGP feeding is needed to perform to her, and why she is receiving this treatment. So, good morning, Miss Drowsy. I am Nurse Samantha Rojas, your nurse for today, and I am going to perform NGP feeding for you to maintain your nutritional status, as well as for me to assess your tolerance to the previous feeding. Then after, of course, we must assist the client into a semi-follower's position at least 30 degrees to facilitate the gravitational flow of the feeding. And this position allows the patient the formula not to be aspirated onto the lungs. Then we must perform hand hygiene by use of alcohol or washing our hands, and wearing the clean gloves. Of course, this procedure may be embarrassing for some patients, so we must provide for client privacy. And then after, assess the tube placement of to the client, and then after, we must attach the syringe to the open end of the tube and aspirating the small amount of contents will facilitate for us to check the pH level of the contents. So the normal pH level contents of the stomach is 3.5 to 4, and place the stethoscope onto the client's stomach while injecting the air, at least 10 to 30 cc's. There. Then, of course, we must assess the residual feedings before administering the new feeding. There. Aspirate all the contents of the previous feeding and measure the amount of the aspirated contents, of course. This is done to evaluate the absorption of the last feeding, whether there is an ingredients with formula from the previous feeding, and if the tube is in the small intestine. If the aspirated contents is 100 ml, we may refer to the agency's protocol for the next procedure. As for some agencies, there's a required amount of ml from the previous feeding before administering the new feeding. Then, do not forget to rinse still the gastric contents as to prevent electrolyte imbalance. And if the client is on a continuous feeding, check the gastric residual for every 4 to 6 hours. Then, on administering the tubing, of course, before the procedure, we must check for the expiration date of the formula and cleanse it using the alcohol to prevent contamination, the cap, if you are using an open system. There. And then after, we will remove the plunger from the syringe and connect it. The tubing must be kinked in order to prevent the air from entering the stomach. There. So now, this is already here. Then we will now add the feeding to the syringe barrel, and permit the feeding to flow in slow procedure so that the patient will not experience any discomfort, as quickly administration of feeding can progress to the patient having flatus or cramps and or may experience vomiting. Then, so now we use the open feeding procedure, but there are also some procedures such as the feeding bag and the pre-filled bottle. As per agency's protocol, we may do those procedures. For the feeding bottle, of course, we will hang the little bag and clamp the tubing, open the clamp and attach the bag to the feeding tube and regulate the prescribed drip. For the pre-filled bottle, for example, is this. We will remove the screw of the cap and close the clamp, hang the container on the pole, and at least 30 centimeters or 12 inches to run at a safe rate, and squeeze the drip. Open the tubing clamp so that the formula is flowing, and attach the feeding set tubing and regulate it. So now, after the contents has been administered, we must inject fluid as at least uh, 50 to 100 ml to flush the lumen of the tube and prevent for future blockage of sticky formula. The contents, the feeding formula must be emptied first before injecting the water. Then clamp the feeding tube before all of the water is instilled, and as clamping prevents the leakage of air from entering the tube. Then ensure the client's comfort. Reposition the client and assess the client's comfort, and securing the tubing onto the patient's gown, and it should be closed there. Then ensuring this will minimize the pulling. Now, as the client will remain sitting upright, reposition the patient into a comfortable position. In sitting upright must also be encouraged to allow the formula to drain, to flow through gravitational flow, and to facilitate the digestion. Then also to prevent aspiration. Also check the agency's institution and frequency of changing of the nasogastric tube and use of smaller lumen tubes, and then after dispose the equipment properly. Remove your gloves and wash your hands there. For the evaluation, of course, we must assess the tolerance of the patient to the procedure, assess for the bowel sounds, and the regurgitation of the feeding, the weight gain, and so on and so forth, and of course relate the findings to the previous assessment data and report it to the primary healthcare provider. And of course, we must not forget to document onto the nurse's station, onto the notes, the feeding, including the amount, the solution taken, and the duration of the feeding of the client, and record the volume of the feeding and water administered, and the intake and output. So, there, done. Thank you. Today, I'm Samantha Juniors, and I am going to perform removing the nasogastric tube. So, we must assess for the presence of the bowel sounds of the patient, of course, and assess there. Then assess for the absence of nausea and vomiting when the tube is clamped. There. For the planning, assess for the client status, and of course, identify the equipments needed. Introduce yourself and check the client's name band on the wristband, and or asking the client herself. Explain that we are now going to remove the nasogastric tube to her, and why, and why she needs to receive this procedure and the purpose of it. So, good morning, Miss Kelsey. I am your nurse for today, Nurse Samantha, and I am now gonna remove your nasogastric tube there. Then, assist the client into a sitting position to promote comfort, and of course we must perform hand hygiene by the use of alcohol and washing our hands, and of course we must not also forget to uh, wear gloves. While doing that, of course, we must not forget to promote for client food privacy and place the disposable pad or towel onto the client's chest. There. We will provide break for to prevent leakage or dripping of the nasogastric contents. There. Then we will provide for tissues to the client and for us to wipe the nose and mouth for the situations. And now we will detach the tube, disconnect the nasogastric tube from the suction apparatus, and unpin the tube onto the client's gown and remove the adhesive tapes onto the client's nose. There. And then after, we will now pull the tubing. Now I have put on my gloves and I will instill a 50 ml of air into the tube. For us to, this procedure clears the tube from any contents such as the previous feeding. Then after, pinch the tube with the gloved hand to prevent the inside of the tube from draining, and smoothly withdraw the tube there. Then place the tube into the plastic bag or onto this drape there. And discard it at the appropriate receptacle, and there. Observe the intactness of the tube and ensure the client's comfort, and wipe the nose and the mouth for any secretions, and assist the client to blow the nose to remove the excess secretions, and dispose the equipment appropriately, and place the pad and the bag, the tube, everything that the client has used into the appropriate receptacle to prevent the transmission of microorganisms. And we must now together with the gloves, and we must now wash our hands there. For the evaluation, of course, we must perform the follow-up examination to the client, the presence of bowel sounds, the absence of nausea and vomiting, and relate the findings to the assessment data, and report significant deviations to the appropriate primary healthcare provider, and document all the relevant information, including the removal of the tube, the amount of the appearance of the drainage, and any relevant assessments of the client if the tube is connected into the suction apparatus. Thank you.